Welcome to the IDR online course. My name is José Carlos Martins da Rosa. I am the developer of the immediate dental velar restoration technique. And I would like to share with you more than 14 years of experience in this subject. I really much appreciate that you take your time to participate in this course. This is a unique and comprehensive course on the IDR technique. I included a series of modules that will discuss the most important and relevant topics on IDR. And regardless of the level of the clinician's skills and individual experience, this course will give you many benefits to improve your daily practice in the treatment of compromised sockets and also in intact sockets. At the end of the course, you will understand why thousands of dentists around the world are applying this technique in their patients and having excellent aesthetic outcomes. The main focus of this course is the technical applications, but all based on science. And I really hope you enjoy the course. But what is IDR? It's a bone grafting at the time of immediate implant placement and provisionalization in compromised alveolar sockets. And we use bone graft harvest from the maxillary tuberosity as a biological membrane to prevent self-competition between hard and soft tissue. But the main goal is the preservation and the regeneration of the natural biology. And some requirements for the technique's success: knowledge in surgery, implantology, periodontics, and prosthesis. Training with the techniques: minimally invasive dental extraction, implant installation in fresh extraction sockets, harvesting bone grafts from the maxillary tuberosity, and construction of the provisional crown with a suitable emergence profile. And here is the program. First of all, I will give the presentation of the immediate dental velar restoration technique. Second, the biology of the post-extraction socket. The next, the minimally invasive dental extraction. Fourth, I will discuss with you about the advantages and the disadvantages of using flap and flapless surgery. How we diagnose the compromised socket. And the next is the classification of the alveolar bone defects and the treatment plan. Why the maxillary tuberosity is the main donor area. And the next, the main focus is the surgical technique, how we take the bone in different situations to take the bone from the patient's mouth. The protocol for selection of implant diameter and post-extraction sites. This is one of the most relevant topics in order to succeed with the IDR technique. And the technique protocol in intact sockets, and the IDR protocol using corticocancellous bone graft. This is the classical IDR technique. The next, the IDR in upper anterior regions. From now on, we are going to focus in the technical applications and indications. The IDR in lower anterior regions. The IDR application in posterior regions. And how to do IDR technique in infected sites, and the influence of the periodontal biotype in infected sites in the IDR treatment planning. The next module, the bone reconstruction aiming to improve the implant's primary stability, and the ossidification and the IDR. Let's put it together, the combination between ossidification and the IDR together. The IDR in cases with gingival recession, how we deal with in case that we have a slight, medium, or large gingival recessions. The next module, the clinical evidence of bone graft incorporation and the IDR biology, why it works, the complications and how to avoid them, and the final conclusions. And how about the learning objectives? First, to diagnose the sockets with bone defects. Second, to learn the treatment of intact and compromised post-extraction sockets with autogenous bone harvest from the maxillary tuberosity. Third, to understand the concept, the bone biology, the step-by-step technique and indications of the mid-dental velar restoration. To fabricate the provisional restoration with ideal emergence profile. And fifth, to use the cortical cancellous graft in several situations of alveolar bone loss. With that said, let's begin with the module 1.